Air pollution and respiratory health. Air pollution poses a significant threat to respiratory health, affecting millions of people worldwide. This essay explores the various aspects of air pollution and its detrimental impact on respiratory well-being, encompassing the sources of pollution, types of pollutants, and the intricate relationship between air quality and respiratory diseases. Introduction. Air pollution is a complex environmental issue with profound implications for human health. It comprises a mixture of natural and anthropogenic pollutants that can have severe consequences, particularly on the respiratory system. We delve into the multifaceted relationship between air pollution and respiratory health, addressing key sources of pollution and the specific pollutants implicated in respiratory diseases. Sources of air pollution. Understanding the origins of air pollution is crucial for devising effective mitigation strategies. Anthropogenic sources, such as industrial activities, vehicular emissions, and the burning of fossil fuels, contribute significantly to air pollution. Additionally, natural sources like wildfires, dust storms, and volcanic eruptions release pollutants into the atmosphere. The concentration of pollutants varies across regions, depending on the prevalence of these sources. Types of air pollutants. Airborne pollutants can be classified into several categories, each with distinct impacts on respiratory health. Particulate matter, PM, ground-level ozone, nitrogen dioxide, NO2, sulfur dioxide, SO2, carbon monoxide, CO, and volatile organic compounds, VOCs, are among the most prevalent pollutants. Particulate matter, consisting of tiny particles suspended in the air, is particularly concerning as it can penetrate deep into the respiratory system, causing inflammation and exacerbating pre-existing conditions. Please like the video and subscribe the channel. Health effects of air pollution on the respiratory system. The respiratory system is highly vulnerable to the deleterious effects of air pollution. Short-term exposure to elevated levels of pollutants can lead to irritation of the respiratory tract, coughing, and exacerbation of asthma. Long-term exposure is associated with more severe consequences, including the development and progression of chronic respiratory diseases such as chronic obstructive pulmonary disease, COPD, and lung cancer. Vulnerable populations. Certain groups within the population are more susceptible to the adverse effects of air pollution. Children, the elderly, and individuals with pre-existing respiratory conditions are particularly vulnerable. Moreover, socioeconomic factors can influence exposure levels, with marginalized communities often bearing a disproportionate burden of pollution-related health risks. Linking air quality to respiratory diseases. Extensive research has established a clear link between poor air quality and the prevalence of respiratory diseases. For instance, studies have demonstrated an increased risk of asthma exacerbations in areas with high levels of air pollution. Similarly, long-term exposure to pollutants has been implicated in the development of respiratory conditions, contributing to the global burden of diseases. Mitigation and policy measures. Addressing air pollution requires a multifaceted approach that encompasses regulatory measures, technological advancements, and public awareness. Stringent emission standards, the promotion of clean energy alternatives, and the implementation of sustainable urban planning are essential components of effective mitigation strategies. International cooperation is also crucial, as air pollution transcends national borders. Technological innovations. Advancements in technology play a pivotal role in mitigating air pollution. The development of electric vehicles, the utilization of renewable energy sources, and the implementation of air quality monitoring systems contribute to reducing emissions and improving overall air quality. Moreover, innovations in industrial processes can lead to more sustainable practices, minimizing the environmental impact. Conclusion. In conclusion, the intricate interplay between air pollution and respiratory health necessitates urgent and concerted efforts to address this global challenge. The sources and types of pollutants, coupled with their undeniable impact on vulnerable populations, underscore the importance of implementing comprehensive strategies to mitigate air pollution. By fostering international collaboration, embracing technological innovations, and enacting effective policies, societies can strive towards cleaner air and healthier respiratory outcomes for current and future generations. Please like the video and subscribe the channel.